There is nothing like a good liver cleanse to improve bowel function, to reduce inflammation, and relieve your gut symptoms. But I'm not talking about just any cleanse. This one is, we'll say, controversial. It's very powerful and, of course, a little bit unusual. We're talking about coffee enemas. Now in this lesson, you're going to learn about the history of enemas and, of course, coffee enemas, where they come from, how they clean your liver, and why you might want to consider trying them, or might not. It's up to you. We're going to talk about the reported benefits, the risks, and the safety concerns of coffee enemas. We'll get into why some people are against them and how to do coffee enemas safely should you choose to of your own free will. Of course, we'll talk about materials, timing, cleaning, etc. And we're actually going to look at some of the studies and the data that are out there around coffee enemas, which is very little. You'd be surprised. That being said, before we do this, because of how controversial this is, it's obviously not an approved medical therapy, but clinical outcomes are incredible nonetheless, which is why this episode is strictly for information and educational purposes only. It is not medical advice. Let's get into it. So first things first, enemas go back thousands of years. I'm not kidding, thousands of years. There's actually ancient Greece. There's stories of Hippocrates talking about enemas to balance the four humors of yellow bile and black bile and phlegm and all the things that he did in medicine. We even have papyrus discussing enemas from ancient Egypt. In fact, fun fact, those who were tasked with what's called rectal medicine or medicine men of the rectum were actually named shepherds of the anus. So there's a fun little tidbit for you today. But here's the thing, coffee enemas actually became popular somewhere around the early mid-1900s. And the documents are kind of wishy-washy as to whether it was 30s, 40s, 50s, but the idea was it actually came from a fella named Dr. Max Gerson. You may have heard of something called Gerson therapy, and this is where it came from. He was using coffee enemas with a bunch of reported benefits from his patients, such as migraines, cancer, chronic illness, arthritis, the works. The issue with this report is that these were self-reported and it's considered anecdotal evidence, which means it wasn't documented, studied, tested, and so therefore the evidence around coffee enemas weren't accepted by the medical community. And even more recent studies around coffee enemas have not successfully been able to directly determine if these enemas actually produce any measurable benefit at all, as far as a scientific method in the medical standard is concerned. Now, here's what I'm going to tell you about it. You're like, Josh, this doesn't make any sense. You're telling me they're garbage. Why are we doing a lesson? Because I have seen over nearly 500 clients now. It's at the time of recording, it's like 470 clients in our program with bowel disease. And many of them have chosen to do coffee enemas. I've done many myself, and every single person has seen some pretty staggering results from them. Anything from immediate relief of symptoms or what seemed to be parasites coming out. They've seen better sleep, better energy, mental clarity. Now, maybe the energy and clarity come from an ass full of caffeine. I don't know. But the idea is we've had a lot of people talking about the benefits in their immune responses, their calmness, their entire body after doing these enemas. Joint pain goes away, the works. Very similar results to what Dr. Gerson got in the early 1900s. So what I want to do now is we're going to talk about the potential benefits. And I have to call them potential because we know the mechanism of action and how they work, but we don't have the studies to clinically and evidently say, yep, this is exactly what it's doing. So we're going to say potential benefits, though we've seen them in clinical. So first things first, we're going to talk about here is the purpose of an enema. Enemas were used for detoxing and drainage. Remember, detoxing is collecting your trash. Drainage is bringing it out to the curb. And so if you're collecting all this trash inside of your system, your body's trying to detox by gathering and neutralizing these toxins. But those toxins still have to leave. We call this drainage. That's the exit doors inside of your body. And two main drainage pathways are going to be your liver, gallbladder, and the bile ducts inside of them. So we're doing coffee enemas. They're huge in drainage, getting things out of your body, the exit door, because they actually improve or increase biliary contractions. Biliary is going to be all those bile ducts. It actually forces them to contract and squeeze to be able to move things through, which means it's increasing bile flow. Now we have also seen parasites can physically block these tubes inside of your liver, these bile ducts. When you look at your liver, your body has these little tubes that run through it into the gallbladder, and that connects with your pancreas, and your body sends bile from here into your small intestine. Okay? Now, these tubes can get congested. there was an interesting little study, you can look it up, from the New England Journal of Medicine. You can type into Google, NEJM, it's New England Journal of Medicine, and look for parasite camera study. They actually took a camera through somebody's bile duct, the tube inside their liver, and they saw a physical parasite swimming around. And those can physically block your bile ducts, which can create pressurization, poor drainage, all kinds of nasty stuff. Other potential benefits we can see from coffee enemas is increased detoxing. Things like mold, which affects 70% of US homes, and they're probably, I'm guessing again, I don't have the data, but I've seen approximately in my practice about 80% of all clients coming through who are dealing with mold as the primary cause or one of the major layers of their bowel issues. And so mold toxins are both lipophilic, meaning they bind onto fat, and they like the bile. They capture in bile and they bind to it. So by promoting that bile flow and good cleaning or good cleansing, or we'll say escaping of the bile. I'm a little distracted, I got a puppy down the bottom here, sorry guys. But by getting that bile out, you don't reabsorb those toxins inside of it. And coffee enemas can help promote that detoxing and that drainage. You get better clearance of toxins so you don't reabsorb and don't stay inflamed. Therefore, you have decreased inflammation as another benefit. Improved mental clarity. Again, is that the elimination of toxins or an ass full of caffeine? Who's to say? And then we also see some other benefits like improved detox pathways. And with less toxins in your body, your immune system and your immune responses also improve. Meaning you'll be less prone to going into flares or having hyperactive reactions, mast cell reactions for those of you who get itchy, anxiety, palpitations, etc. So lots of good benefits. Now, coffee also contains some pretty interesting compounds. Now again, most people do prefer to drink coffee the traditional way down the front, but if you go up the other side, it has the same benefits. There are lots of vitamins inside coffee. There are vitamins B2, B3, B5, B9. You can get magnesium, potassium, chromium, polyphenols, antioxidants, and of course the caffeine. Keeping in mind, caffeine is not a stimulant by itself. It actually blocks the adenosine receptors in your brain. Now, adenosine is one of those things that makes you go relax and kind of calms you down, helps put you to sleep at night, it builds up during the day. But by taking caffeine, you block those receptors, so your body doesn't get that relaxation. So it's less a stimulant, more of a blocker. Interesting tidbit. But the question you want to be asking is, does this coffee just mobilize toxins in your body? Does it actually get rid of these things from your system, or does it just get into the crypts and folds inside of your intestines and clean out a bunch of junk on the surface level? Or does it actually pull things from your bowel, from your liver, from your bile? And that's the idea behind them. So we want to ask the question, is it actually promoting drainage, or is it just simply pulling things that are in the bowel, like making you have a really good bowel movement? Well, what I can say is I've had many clients going through protocols for things like parasites and fungal infections, viral infections, who do these coffee enemas, and the next day they feel better than they ever had before. It accelerates a lot of their health and healing. Remember, not medical advice, just letting you know. Or people who are on parasite programs or parasite cleanses for a month, two, have no movement, do a coffee enema, suddenly they got them all wrapped around their stool and they're coming out everywhere. So we've seen a lot of positive benefits. But it's also important, this isn't just a fantastical conversation. This is a very practical conversation. I want to talk to you about some very real concerns that you may have about things like safety. And this is where the internet gets up my ass about it, pun intended, because they want to say, well, you're a quack, it doesn't work. You're right, there's no data on it. I'm just giving you the evidence and what we've seen in clinical, what's self-reported, versus what the actual studies say. And the more you look into studies and read them, the more you realize they're guidance at best. Like most studies are just guidance at best, and many can be fabricated in a lot of different ways. So we have seen some safety concerns. Right? So some safety issues we've seen are going to be things like caffeine sensitivity. So if you're somebody who has a sensitivity to caffeine, gives you headaches or migraines, maybe don't do it, right? Because you need caffeinated coffee. Maybe we're seeing an increase of hypermobilized toxins. That might be something worth noting. There's a potential for that. This is why we always go slow, and we'll talk about that in a minute here. We always want to use binders. Also, for those who might be pregnant, 200 to 300 milligrams of caffeine hasn't been connected, but it's been correlated to increased risk for pregnancy. So for those of you who might have be worried about lower birth rates, of course, there's risk of miscarriage, stillbirth that might be concerning that we've seen potentially in pregnancy with 200 to 300 milligrams of caffeine a day, which you can get through a full 2-liter, fully packed, fully concentrated coffee enema. Some of the other risks, of course, are going to be rectal injuries. Now, this is a no-brainer. You put things up where it's not supposed to go, something might hurt. This is why the catheters are often very small. There have been rectal injuries reported like burns. Guys, I should not have to tell you, if you're doing a coffee enema, don't put hot coffee in your butt. Like, I shouldn't have to say it, but it's a disclaimer, okay? I'm not telling you to do this. There have been medical trauma, people who insert too fast, too far, or don't use any kind of lubricant. If you're putting a tube in your butt, use lubricant, okay? This isn't rocket science. But there are some concerns we have to note regardless. Other things we want to look at for the coffee. Guys, look at things like quality. If you decide to do a coffee enema, don't go off the shelf and just buy Folgers or Tim Hortons or whatever it is you can find that's cheap. It needs to be medical grade, like enema coffee. It should be mold-free, pesticide-free. Ideally, it's going to be medium to light roast at best to preserve the nutrients. It's going to be air roasted. It's going to be heavy metal free. It's tested through the roof to make sure it's as pure and clean as possible. And then of course, another risk that people have reported or that have been reported on some studies is infections. Obviously, if you're not sterilizing your equipment properly, it's like anybody who does injections at home, if you use insulin pumps, so you got to clean your sites. If you're not cleaning your equipment properly, you're prone to infection. So every report that's really been there, that we've seen studies, and there's actually a study, I wrote down the number, I'll get there in a sec. I'll get you the actual PubMed article number you can read, where they actually assessed 9 different case reports that were all self-reported. It was all just improper use. Okay? So it's like saying cars are dangerous, everyone gets injured because nobody knows how to actually drive. Right? It is a medical procedure, so you need to be trained and have to be confident on how to do it properly and safely. That's all I'm going to say. Okay? Other reports that people have found, electrolyte imbalances. Of course, it can be dehydrating, increasing bowel movements, moving too much water, the osmosis can change. If you're not hydrating properly during the day, you're prone to dehydration. There's also, here's an interesting one, they say there is a risk, and this is on some of these studies, of increased biliary spasms. What does that mean? Well, the literature will tell you there's no evidence that it promotes increase in bile flow or liver detoxification. Well, biliary, in the bile ducts inside of your liver, spasms or contractions. Well, if you're contracting tubes full of fluid, those tubes are going to move. So we do see an improvement or increase in bile flow. Again, I've never seen it be a problem. This is all studies done on anecdotal reports anyway, so take what you want from those. On other notes as well, if you do them too much too often, there's dependence risks and people can get addicted to the feeling. You could argue the caffeine, getting too much clearance or having motility issues or not enough clearance after using them too frequently. For example, the Gerson therapy we talked about in some of these protocols, he was having people do 4 or 5 coffee enemas a day. That's like a full day in the bathtub with coffee in your butt, right? So it's crazy. But in clinical, some practitioners may have their patients or their clients do them once or twice a week for a short span if they can tolerate them and if they get benefit. But by doing them too much, of course, those rectal stretch reflexes can lead to lower bowel tone and poor evacuation. So we just want to be careful. That being said, after all these warnings, I have to give them to you for all the legal reasons. This is not medical advice. This is not considered a safe medical procedure, but people who do them do feel amazing much of the time for those of you who might be crazy enough to try. That being said, how would you do them safely? If you were to do them, not that I'm advising you to do it, how would you do them safely? Well, first thing you're going to need is your equipment. So first things first is going to be an enema kit. Now that can either look like a medical grade silicone bag or like a steel bucket, stainless steel. Most of those can often be bought on Amazon. Just watch your suppliers because you don't know where it's coming from. But proper medical grade, you're gonna want some kind of kit. Now that kit's gonna come with the tubes, the catheters, the bags, all the things that you need. I recommend hydrogen peroxide, cleans very, very well without alcohol, which may strip some of the silicone. So you wanna be careful to preserve your product. But you're going to need enema grade coffee, like we talked about. Clean, organic, pesticide, mold, heavy metal free, fully tested, the works, whatever it is that you need. You want it to be not instant coffee, again, medium roast, preserve a lot of those things, and don't run it through a coffee filter that's full of plastics. Right? If you're gonna do it, use a French press or a glass French press just to keep this as clean as you can. And of course, you wanna make sure that you're using some form of either distilled, reverse osmosis water, not like a Brita filter or tap filter. There's a lot of junk in those, so make sure it's clean water. So first things first, what you're gonna do is just start very, very slow. The idea is, for most enema, common practice will be filling up to a 2-liter bag full of coffee, anywhere from 1 to 4 tablespoons of coffee inside of the enema bag. Now, if you're going that route and it's your first time ever, You can fill the 2 liters, you might not end up using it, that's okay, but try a half a tablespoon or a tablespoon at best if you're gonna go this route, just to make sure you don't overload yourself. Too much caffeine at once can stimulate a lot of motility, it can stimulate a lot of detoxification, can make people feel nauseous at first if you're not used to it. I've done several dozen of these things for my bowel protocols, and it's been incredible what it's done for me and how it's accelerated my healing process. And again, the world says, that's stupid, it can't work, show me the studies. You can't talk to those people. So here's the thing. Studies are important, but data is importanter, okay? And so you're gonna start nice and slow, brew 2 liters and let it cool. You don't want those burns. Anywhere from 97 to 100 degrees, so temperature check it, use a thermometer with that clean water. You're gonna sterilize your kit right before and right after use. Sterilizing it, then bagging it doesn't count. It must be sterilized right before and right after use. And then of course you flush the coffee through the tube so there's no air. In the bathtub on your right-hand side on a towel. Get it in there, lube it up, get it in just a little bit to get the coffee in and go slow. There's different types of enemas. You can call it the pump and dump. You put some in, hold it for a minute or two, dump it out. Most common is going to be a retention for as long as you can, up to 10, 12, 15 minutes, depends on what your goals are, and then empty and evacuate. Pretty straightforward for the most part. But there are some things to watch for. I'm just going to put a note, some things you should know. It's very, very common to get spasms because just like having a full bowel full of stool, your body wants to get rid of it. It's like, this shouldn't be here. The stretch reflex kicks in. Your body wants to evacuate. Easy breeze. So spasms are common. Oftentimes, for those who have the ability to, you can just breathe through it. It often passes. If it doesn't, just dump it out. Let it go. You also want to test your clearance if you're going this route. If you're detoxing too much, too fast, you can feel sick. It might cause some bloating, it might cause some irritation, or even worst case, like diarrhea into the next day. That's the worst I've ever seen people do if they go too concentrated too quickly. But I've never seen it cause a big problem, right? It's all dependent on volume and your tolerances. But there's that PubMed article here. I actually have a number written down. If you guys want to go check it out, you can just Google PMC. That's going to get you onto your PubMed. The number is 747. Let me look, 8478. So if you want to go and check this one out to say, hey, I heard there's bad reports, this is one of the ones I could find, and it's 9 self-reports and people who said, oh yeah, I got hurt doing it. So if you took 9 reports from bad drivers say they got injured, driving's bad too. That's just my thoughts. But they talked about the electrolyte imbalances. Some people actually got colitis due to infections, things like that. And I have never seen these, ever. In the hundreds of people I've suggested this research to who have done them, I have never seen this actually happen to people. There have been some other things people complained of, infections and burns, and there was 1 or 2 reports that some people claim that there was a death involved. Okay? So, Josh, why on earth are you talking about this? Sounds like a radical, crazy, nonsensical type of liver detox. I have to give you the cautions, even as rare and extreme as they are. It's kind of like going in and getting your blood drawn or donating blood. A lot more people will get blood infections, illnesses, sepsis, and maybe even die if they didn't do the procedure properly. If they didn't use sterile equipment, if they didn't sterilize the site, if they injected like they do in the movies, they go straight in with the needle rather than on an angle into the vein. There's a lot of things that can go wrong if you're not doing it properly. But under supervision, honestly, it's a very safe procedure, extremely safe. Right? People give themselves home injections all the time. You just have to know the procedure to sterilize the sites and things like that. So I'm not obviously saying you should do coffee enemas. I don't know you. I can't make that recommendation. It's not medical advice. But I'm here to give you, for information and educational purposes only, that I have seen these do incredible things for people dealing with detox, drainage issues, inflammatory issues, autoimmune conditions, bowel disease. And I make this a very important point in many of the people that I work with in our practice to actually take a look at, to find information to see if it's something they want to try for themselves, because it really does produce powerful results. Josh, show me the studies. Look at the clinical data, look at the self-reports, do some research on them. Don't look at your research from the people who have heard that they're bad. Look at the research from the people who have done them and see if it's bad or good for yourself. And that's the information I can tell you. Here's what I'm going to wrap up with. Detoxing and draining your liver is extremely important for those with bowel issues. Drainage is one of the most important things you can do. It's one of the most important preparatory phases that you can do, because draining, getting toxins out of your body, is as important, if not more so, than detoxing itself. There's arguments on both sides that your body detoxes already. Your body's already detoxing. Your liver, you're right. But so many of us are so toxic and we're so full, our drainage pathways also become congested. If you're somebody who goes out to the gym and it takes you a while, or you don't break a sweat at all, that's a drainage pathway, your skin. If you're somebody who gets swelling in your ankles, your feet, your belly, or your feet, or your thighs, there's lymphatic tissue there, your armpits. You put your arm up and it's like a bulge and it's kind of waterlogged. That's a drainage pathway. That's your lymphatic system. If you're somebody who either gets oily, greasy stool, or it's green, or it's gray, or it's yellow, or it's really foul and rancid smelling with any of those things, that can be a bile flow issue, which is a drainage issue. If fatty foods make you nauseated, you have issues that way, that's a drainage issue. All these things indicate problems you might be having under the surface. So you can say, Josh, I'm going to detox. What you do is you collect all of that trash into your little trash bucket, and your body says, okay, it's time to get it out. And then it goes nowhere. And so that trash piles up and piles up and piles up until it overflows. And now it's all over the house. So that garbage, those toxins move from one room to another. They move from your liver where they're congesting, into fat cells where they're congesting, into nervous tissue. Now you got anxiety, you've got headaches and migraines, you got light sensitivity, you got all kinds of issues. Those inflammatory markers build up, your body becomes more reactive. Now you've got asthma and rashes and hives and other issues happening, food sensitivities, because your body is accumulating toxins. It's collecting them, but it has no exit door. So these coffee enemas are used in drainage protocols. Drainage precedes detoxing, because your body's already detoxing. But if you promote more detoxification without proper drainage support for those of us who are congested, you make things worse and you spill. And that's why we're doing it. If this is making sense to you and you want to get some help with this, I'm going to show you how you can do that. But I want you to know there are a ton of resources available. If you don't already know, I got 2 podcasts. You can find these in my profile on Instagram. Go to joshdeck.com. You can find me all over the place, but they're all free. My mission is to make this information free to the world because everybody needs to know it, because you can be your best advocate. So I've got a podcast called Reversing Crohn's and Colitis Naturally. I've been doing these lectures for years. I just recently started putting them up on the podcast so you can access it for free from anywhere. They're also available on YouTube. If you want to check out another podcast, not just for bowel diseases like Crohn's, colitis, other health stuff, other gut stuff, check out my other podcast called Reversible, also in the links in my profile. It's on my website. You can find them all over the place. But we talk to some of the world's best experts. Dr. Stephen Gundry, Dr. William Lee, we've had Dr. Jeffrey Bland, Dr. David Perlmutter. We've had the works, and they're incredible, incredible. And we just talk about how you can heal your body naturally. But if you're there and you're like, Josh, I need some help. This feels really complicated. I've heard about this stuff. You're looking at root causes. You're actually getting to drainage. And I feel like there's a way I can get some help. We're here to help you. It's all we want to do is just give you the information to help yourself. So you can do that very simply. If you're on YouTube, you're on the podcast listening right now, check the links down below. Send me an email. Ask a question. Check out the website. There's a ton of free resources. But if you want some hands-on direct help, this is how you're going to get it. Guys, that's all we got for you for now. If you missed anything, you can always get back on the replays. Thanks so much for being here. We're going to see you guys next time. Now we're going to pop over to the questions if we've had any pop up here. I should have let you guys know ahead of time that we do have question time available. But let me drop over to the Facebook page to see if we have any questions in our chats. If not, that's okay. You can always message me later or comment below, and I'll do my best to get back to you guys. If you have any questions, now's the time. Here's the thing. Gut issues, no matter what they are reversible. I can't say legally, I still can't say this, and I never will, never have. I cannot say I can cure, treat, or heal your condition, but I believe they are curable. I really, truly do. I believe Crohn's, colitis are curable conditions in the vast majority of cases. And for those on the outliers with a lot of immune hyperreactivity and issues, we're not very far away from actually seeing true cures come down the line for that immune dysfunction. But on the side of those who are in a chronic inflammatory state, who don't have any immune collapse, their immune system just hyperactive, I do believe they're curable conditions. And I get a lot of hate mail about that. I've talked to some of the best, and they agree. So this isn't just like some loon on the air. I mean, you can call them loons too. Dr. Jeffrey Bland and I had a chat. He says, I agree. I don't think the body can just attack itself randomly. But let's pop on over and see what we got over here on Instagram.
Heather says, I've been getting recurring diverticulitis.
Big word.
Yeah. Would coffee enemas help?
So Heather says, I've been getting recurring diverticulitis. Would coffee enemas help? I can say yes and I can say no. This one's contextual, Heather. Now, anybody else listening, I see some questions here on Facebook. We will get there. Make sure you drop them in. Will coffee enemas help with diverticulitis? Theoretically, yes. Diverticulitis is inflammation of the diverticula, and you often get these little pouches and pockets. Almost looks like pimples inside the bowel. The issue with this, they're largely large intestine. So coffee enemas will get through the area. It could be topically irritating. It might be helpful. But the root cause as to why you're inflamed, Heather, that's the first thing we have to get to. If you don't address the thing that's causing inflammation, then the coffee enemas, like any kind of medication, is a band-aid. Here's the problem. We take this chronic inflammatory condition, right? And I'm talking all therapies, not just medication. I am talking about enemas, supplements, vitamins, whatever you're using. We have these chronic inflammatory conditions, and we take acute treatments, infusions, medications, whatever it is, and we apply them chronically. And that's how we're treating disease, rather than getting to the root cause. So will coffee enemas, can they be helpful in a protocol designed to get to your root cause and remove the thing your body's inflaming to? Yes, but in and of themselves, it may not be beneficial. It might, but again, if you're taking this acute treatment and using it chronically, then you do run more risk factors in the long run. And again, you're just managing. But if you do want to understand the root cause and how this works, Heather, I'd be happy to send you some resources on that. If you want to have a conversation about it, I'd be happy to do that. There's a lot of ways to get answers, and I just want to make sure you have them. Whether it's with my team or someone else's, I don't care. You just need those answers. I've got podcasts on it, YouTube videos, and again, I'm always happy to have a chat. I hope that helped answer the question. If you have a follow-up, drop it below. I'm going to move over to Facebook. Next question on Facebook, for those of you just getting in, if you're on Facebook or Instagram, great chance to drop your questions in. Cassie says, I've never been one to really sweat. It takes a lot, in bold letters. Which drainage pathway is that connected to, and how can I open that up? Let's talk about drainage. You have 7 main drainage pathways. These are exit doors inside of your body. So the first big ones are going to be liver, your gallbladder, and we're going to say bile ducts. It's all connected to the same thing. You have your lymphatic system. Now think about your lymphatic system. It's part of your immune system. A lot of junk moves around through there as well. But like your heart has blood vessels attached to it where it pumps blood through those vessels, that pump moves, and these doors, these valves in the vessels open and close. In your lymphatic system, you have valves all the same, but you don't have a pump. So your physical movement moves your lymphatic system. That's how you do that one. You also have your skin. That is a drainage pathway. So getting sweaty. So if you're not warm yet, if you want to get that stimulated, if you're having trouble, wear sweats, infrared saunas, start slow and work up, because it can be a lot for some people, but sauna therapy can really help. Another major drainage pathway is going to be your sinuses. We'll call that number 5. Sinus rinses, nasal flushes, saline. Some people who might be living in mold can benefit from a bit of colloidal silver and even a humic fulvic acid, very fine powder in that nasal rinse as well. So you got your liver, gallbladder, bile ducts, lymph, skin, sinus. Then of course you have your bowels, and then you have your kidney bladder. Now there are other arguments you can make to say sinuses and lungs because you can exhale and off gas. Other people might argue brain in that blood-brain barrier and cells. So you could say that's either 9 or 10 drainage pathways, but these are our focuses for all intents and purposes. That being said, we want to get these exit doors open. So if it's a lymphatic issue, you're congested, move around. If you're having a sweating issue, you're not able to sweat, coffee enemas it's a collective bucket. It'll often happen where if your liver, gallbladder, bile ducts, they're all congested, for example. It happened to me when I had really nasty parasites and candida. All those toxins went through the emergency hatch, poop, and went through, I said poop, what a context to do it in, but they went through my skin and I got acne. So it can push through other places. I had trouble sweating as well. But as I opened up my liver, gallbladder, bile ducts, I got my bowels moving properly, then I started sweating more easily. And so what we want to look at here is the collective whole on how they're all connected and what's really the thing that's causing the plug in your main pathways, which ones are overflow, which ones are primary. Hope that makes sense. If you have any follow-up questions, now's the time. Any more on Instagram?
Heather says thanks.
Oh, Heather, you're so welcome. Thanks so much for coming. We are here every Wednesday night at 5:30 Mountain Time. So on that note, guys,